Hello, Shubha. Can you hear me?
Hello, sir. Yes, sir. I can hear you.
Okay, great. So, how are you?
Yes, I'm fine, sir. How are you?
All good, all good. So, how's everything in your place there? How's the situation?
Yes, sir. It's fine now. The cases are reducing.
Okay.
So it's fine. Yeah. Now we can get out of the house.
Hmm.
Mm.
What about college and everything? How's
College, yeah, it's fine. Patient flow is little less. That's the issue. Otherwise, it's okay.
okay? All right. Yeah, Shubha. So, you want to try just sharing your slide
Yes.
once?
Yes.
Do that. Yeah.
Is it visible, sir?
Yeah. Yeah. Could you put that on the
Okay.
slideshow, please?
Yes.
Yeah. Have you put that on the slideshow?
Yes, sir.
We're not able to see that. I think the screen just froze. You can just stop share and redo it. Not a problem.
Okay. Is it visible now?
No, it's still in the presenter view. Like we're not able to see the full screen of the slideshow. It's okay. You can just end the sharing and do that again. Sometimes there's usually a lag.
Yes.
Okay. Try sharing it now again.
Yes, sir.
Okay.
Is it visible, sir?
Change the slides, maybe. No, we're not able to see the. We can see your PPT, which is open, but it's still in the presenter view. Like we can see the outline on the left side.
Yeah.
Have you checked this thing?
Yeah. Yes, sir. It's in full screen only.
Okay, so full screen is it? 1 second. Let me just do it from my end. I'll just show you. Okay, you able to see your PPT now?
Yes, sir.
My end. Okay.
Yes.
And I've put this into slideshow view. Now, do you see the full screen?
Yes, sir.
And you see the slide changing?
Yes, sir. Yes, sir.
Yeah. Now just try that from your end.
Yes, sir.
Okay. Meanwhile, let me just. Yeah, you can do that. No problem. So there are participants joining in. Okay. Good evening, everyone. Welcome back to PhD 101 National Level Rapid Revision series for teaching and learning public health dentistry. So I hope all of you are doing well. Good evening. Dr. Deepak is there, a postgraduate from GDC Shimla. Hi, Deepak. How are you? And we have Dr. Vinamrata. Yes, I believe a postgraduate as well. We have Dr. Hi, Deepak. How are you?
Fine, sir. I'm fine, sir. How are you, sir?
Everything in Shimla must be terribly cold.
Yes, it's very terribly cold. This time we have a lot of people.
Okay, that's all right.
Yeah.
Okay, thank you so much for joining. Good evening, Dr. Manjunath Pranik sir. Pranik sir is here. Good evening, sir. So great to have you, sir. Always a pleasure.
Yeah, good evening, Dr. Denzi.
Yes. How are you, sir? How's everything in Bangalore?
Yeah, I think it's fine. Long time.
Long time. So they're getting back to normal. So I think it'll take some time.
That's
Okay.
nice.
Great. Nice, sir. Okay, glad you joined in, sir.
Thank you.
Hi, yes, sir, please. Dr. Priya is here, postgraduate from Cuttack. Hi, Priya. Zeba has joined in. Okay.
Good evening, sir.
Yes. Good evening, Priya. Hope all good there.
Yes, sir. Okay.
Okay, fantastic. Okay. Yes, Shubha. So I think there happens to be a
Yes.
problem with the
Now is it
slideshow.
visible?
No, we can still. What about the others? Priya, can you just give us some feedback from your end? Are you able to see the PPT, the slideshow, or is it in the presenter view?
It's in a presenter view, sir.
Anna? Yeah, it's in the presenter view. You do one thing, Shubha. I think you can just change the slides without going to slideshow. It's okay. That's not a problem.
Okay, sir.
You can just reshare it again, like stop and reshare it. Usually there's sometimes a problem with the Microsoft PowerPoint software. So it doesn't
Yes, sir.
relay the commands to slideshow mode.
Okay, sir. So now if I'm changing the slides, is it visible?
Yeah, I can see. Yeah, we can see.
Okay, sir. Okay.
So you can just reduce the space in case, or otherwise also it's fine.
Yes, sir.
Yeah, and there's no lag in the connection, right? But at your end, you're able to hear
No,
it
sir. No.
clearly.
Yes, sir. Yes, sir.
All right, fantastic. Okay, then let me just start off with the introduction. Good evening again, everybody. Thank you all so much for joining in here. As always, what a delight to have everybody and continue this learning of Public Health Dentistry 101. And today we have with us Dr. Subhashree Mohapatra. A little bit about our speaker for today. Dr. Shubha has completed a master's in Public Health Dentistry, MDS, from Savita Institute of Dental Sciences in the year 2020. She has completed a BDS from Manipal College of Dental Sciences, Mangalore in the year 2016. PG again, she secured first class with distinction. She also holds an ICMR certificate course on health research fundamentals from the NIE, which is National Institute of Epidemiology, Chennai, which she emerged to top the exam with a 93% aggregate. All right. Previously, she has worked with Doc Plexus Pune as a medical writer. And now presently she is working as an assistant professor in the Department of Public Health Dentistry, Tirumala Institute of Dental Sciences and Research, Nizamabad, Telangana. To her academic achievements, she's received the Academic Topper Award in PhD and various national and international publications to her credit. She works on specific core areas related to problem solving, and a lot of statistical data analysis is also one of her fortes, and of course leading with a lot of consultations and accolades to her credit. So given that brief introduction, we have the privilege of having Dr. Shubha take out her time today and take up a very important topic for our postgraduates and faculty members as well, which is the role of voluntary agencies in dental public health. Now, just to give a little bit of background about the topic, as we are well aware that there's a lot of social welfare organizations and ancillary organizations which work towards providing dental services, or which function and as these agents for change in the dental public health area. Now, what is the role of such voluntary agencies? How much do they contribute? What is the impact they hold? And a couple of illustrations from the Indian scenario as well as the global scenario is what we shall be discussing today. A point of reference for the postgraduates, this is very useful information because it is well researched and thought after, and it has also appeared in a couple of examinations. So that's the reason we chose this topic, and we're so happy that Dr. Shubha agreed to do this for us. With that brief introduction, welcome again, Dr. Shubha, to the podium. And yes, you may now present your session.
Yes, thank you so much, sir, for the lovely introduction, and thank you for giving me a part of PhD 101 and giving me a chance to present here. So, hello everyone, my name is Dr. Subhashree Mohapatra, and today we'll be discussing on the role of voluntary agencies in dental public health. So, I'll start my presentation with a very famous quote given by Elizabeth Andrew. Volunteers do not necessarily have the time, they just have the heart. So with this small quote, we'll start with the introduction. So first we need to know what is a voluntary health agency. So a voluntary health agency is an organization that is administered by an autonomous board, which holds meetings, collects funds, and expends that money for providing care, health education, and research works. So, what are the functions of the voluntary health organizations? They support the government agencies in the work that they do. They also conduct research. They help in educating people. They also help in demonstrations. So suppose there is an example like Rockefeller Foundation. They developed this Bohr latrine in India. So since they developed a new program here, they have to demonstrate it to the public also, right? So how to use the Bohr latrine. So they also involve themselves in demonstrations of new programs. And also they help in advancing health legislations. So keeping this in mind, what are the advantages of voluntary health agencies? So they are better accepted, and the programs are very flexible, and the community participation is also better. They work at a fast pace and low operative costs. And also they provide opportunity to individuals or volunteers who are interested in social work. But also limitations also come with this type of agency. So what are the limitations? The programs are related to non-critical health problems, because since volunteers are involved in this program, that they cannot cater critical health problems. And also the services are not always targeting those who are in greatest need or area which needs them the most. And also the programs often do not run according to the modern principles and techniques. Since only volunteers are there, the funding is also very less. So they cannot adopt the modern principles and techniques of management. So with this small introduction, I'll be discussing the various national and international voluntary health agencies in dental public health. And then I'll just discuss what are the strategies we can adopt to improve the oral health in India. So coming to the national voluntary health agencies, I'll be discussing a few very interesting agencies which I came across, the functions which they are providing, the treatments which they are providing. So the first one is Oral Health Promotion Foundation. So under this organization, they have developed a mobile dental van with portable dental chair. And this van is named as Smile Express. So as we all know, portable dental chair means easily it can be taken to doorsteps. So they provide on-spot diagnostics, preventive and curative dental services to the underprivileged and rural people at their doorstep. So it is very easy. And till now, they've covered over 200 villages, and they've conducted over 300 screenings and treatment camps. And mostly this van is functioning in Jaipur in Rajasthan. So this organization has also set up over 25 counseling and tobacco cessation camps, and it involves over 70 frontline workers, including ASHA and Anganwadi workers. So here is the pictures of the van and the portable dental chair which they have used. So it has the three-way syringe, it has the aerotor, and it has the scaling machine also. So everything is present in this portable dental chair. So this is something very unique about this organization, and we can actually adopt from this organization. The other one is Faith Works India. So this is a religious organization. So this organization has started a project called Healing Touch. So here in this project, what they are doing is they have merged the health and oral health services, right? So we have been promoting this from a very long time, that health and oral health services should be provided to the patients or the public together. So this organization, it's doing that. So it has a mobile clinic, and that in that mobile clinic, they are providing both medical and dental care. So this program is a very good example of the role of non-governmental organization in promoting health and oral health. So another interesting one is Smile Train India. So this is an NGO that supports free cleft lip and palate surgeries. So what is unique in this program is that they believe in comprehensive cleft care. So there are many agencies which provide cleft surgeries, but here they believe in comprehensive cleft care. So what does this comprehensive cleft care means? So not only they provide only like cleft lip and palate surgeries, they want to combine it with other surgeries also. So they are providing orthodontic treatment. They're also providing speech therapy. They're also helping with nutritional support. So that is comprehensive cleft care. And how are they obtaining it? They're using a sustainable model. So they have developed a model called Teach a Man to Fish. So basically what they're doing in this model is they're focusing on training local doctors. And so that they can provide this comprehensive cleft care to their own communities. So this is also a very unique thing which this organization is doing, comprehensive cleft care using sustainable model. Another interesting one is the Impact India Foundation. So this foundation has developed the world's first hospital train, and they have named it as Lifeline Express. So this train has been developed by collaborating, there is a collaboration between the Impact India Foundation, Indian Railways, and the Health Ministry. And so far they have benefited around 6 lakh poor people in rural India. And recently in this train, they have inaugurated 2 additional coaches. That is, one is for cancer and one is for family health service. So what are the dental services they are offering in this train? So primarily it is plastic surgical correction of cleft lip. And also they have conducted quite a few dental camps and treatment camps for rural population. So here is one image of the train and the OT inside the train. As of now, this train is parked in Assam. Okay, another interesting one is Oral Cancer Foundation. This was launched by IDA in 2007. So what is unique about this foundation is that they have this spot centers. What is spot center? It is spot prevent oral cancer trauma. So this is the center that aims to promote early detection and intervention of oral cancer so that they can reduce the incidence of oral cancer in the future in India. And also this center has many training programs for the healthcare workers in cancer detection. And this program has also introduced brush biopsy technology in India. So what is brush biopsy technology? Basically in this technology, you can detect and treat oral cancer at a very early stage so that we can prevent we can go for life-saving intervention by the dental professionals. And using this test, you can detect cancer at an early stage and the lesion can be removed years before it can develop into oral cancer. So early detection of cancer and treating it at that stage itself. So that is brush biopsy introduced by Oral Cancer Foundation. Another one is Mission Smile. So in this organization, they cater to cleft care and surgery for children and adults born with cleft lip, cleft palate, and other facial deformities. So till now, they have screened more than 61,000 cleft affected children and have performed more than 39,000 safe corrective surgeries. So here, this is a beautiful example of public-private partnership. So they have formed an association with the government of Assam and the National Health Mission. And right now, the mission is towards creating cleft-free Assam and Northeast Asia. So they are providing a lot of cleft surgeries to these children, and they plan to announce Assam and Northeast India as cleft-free states. So there is another one, another NGO called Angel Dentist Network. So this is India's first all-dental NGO. So this is India's first all-dental NGO, and it has collaborated with several other NGOs and government entities to organize outreach camps for oral health services. What is unique about this organization is that it has developed one app called ComCare app. So this app is for the volunteers. So it provides a digital volunteer management tool for the new and the current volunteers. So what are the features of this app? It collects and registers volunteers' demographics. It displays the updated information about the upcoming outreach programs. And it also provides access to training videos, and volunteers can also post their camp experience feedback. So this app has been developed for the volunteers, for the betterment of the volunteers, so that they can easily enroll into this organization, and for their easy access to training videos and updated information about the outreach programs. So this is one unique feature about this organization. Another one is Global Dental Relief. So this is there in India. Apart from India, it is also functioning in Kenya, Mexico, Nepal, and several other countries. So in India, it was founded in 2001 as the Himalayan Dental Relief Project. So how did this project start in India? So it has a very nice history to it. Actually, one dentist from New Zealand, he came to Ladakh for trekking. And what he thought was that since this is such a beautiful place and such a remote place, children over here would be having a very good oral health. So he just conducted a study, just a survey to see what is the oral health status of the children. But what he had in his mind was that the oral health would have been very good. But then he found out that almost all the children, they were having dental caries and the oral health was very poor. So that is when he decided to start this Himalayan dental relief project. He collaborated with 10 other countries, and then this project was started. So this project has two locations, one in Ladakh and one in Darjeeling. So in Ladakh, the clinic is set up in the children's hospital in the small town of Leh, and the other one is in Darjeeling. So here the volunteers are also benefited by this program because volunteers get to fly to such beautiful places like Ladakh and Darjeeling, and they can serve the children there and also have a good time there, seeing the hill towns and the tea covered hillsides. So this was the clinic that brought dental care to Darjeeling. This is a place in Darjeeling called Kurseong. It's a district there. So this clinic, this project brought dental care to this district for the first time in India. So this is again a very unique organization that has brought dental care to Darjeeling. So another one is Trinity Care Foundation. This serves the underprivileged sections of the society, and it is running since 2007 in Karnataka. And again, this organization is a very good example of collaboration with the government. So it has collaborated with the National Health Mission and the government of Karnataka. So what are the programs running under this? So one is crowdfunding projects. So as the name suggests, they take this funding from the crowd or the general public. So they provide free surgeries for cleft children, and also they are involved with speech therapy for these cleft children. Another program is facial deformities program. Here they go for treatable facial deformities such as your cleft lip, cleft palate, TMJ ankylosis, etc. The outreach program. So they have this school health program known as Shale Makale Arogya program. So this program has been started in collaboration with the education department over there in Ramnagar. So here they provide dental health education and screening and dental care through mobile dental unit. So this is a very good example of mobile dental care services used by NGOs. And the necessary referrals for advanced dental care is also available over there. So now we have discussed a few national voluntary health agencies. Now I'll be covering a few international voluntary agencies and what all we can learn from these agencies. So one very good example I came across was Oral Health Foundation. This is running in UK. And recently it has launched its new strategy for oral health, and they have titled it Better Oral Health for All. And it will run until 2024. So it has a lot of aims and objectives. So these are the few of them: helping the most vulnerable members of the society with oral camps, making sure young people are given the very best start in life by providing them with healthy mouth at the early stage of their life, giving all people access to free, practical, and emotional support for their oral health problems, meeting the needs of organizations by creating products and programs so that these products and programs can deliver trusted educational messages and training for better oral health. And also, of course, they want to have an impact on the health of future generations. So what are the programs running under this? So one is National Smile Month. So this is going to be celebrated this year between 16th May to 16th June. Here, what is the motive of this program is that they want to raise awareness of important health issues. So, and they want to put a smile on everybody's face. That's why this program is called National Smile Month. Then another interesting one related to our oral health is Mouth Cancer Action Month. So they celebrate this Mouth Cancer Action Month every year in November, basically to raise awareness about mouth cancer. So under this Mouth Cancer Action Month, two very interesting programs they are having. One is Blue Wednesday. What is this Blue Wednesday? It is like a program which they run every year on 17th November. So here what they do on this day, they ask the public, the general public, to go for a self checkup of their mouth for mouth cancer. And that is what they tell, that it takes only 45 seconds to check your mouth if you have any cancer, and this can actually save your life. So this is a very interesting program which they are running, and I think we can also adopt this program. So another one is Blue Ribbon Appeal. So this is another program which is conducted every year in November. So here they urge everyone to wear a blue ribbon badge with pride. And till now, more than 250,000 people have worn this badge. And also this badge, it costs just £1, and that money, it goes in helping the people in their charitable goals. So these are very interesting two programs which is run under this which is running under this Oral Health Foundation, which we can also adopt. So they also have oral health programs in the classroom. So one of them is Dental Buddy. They have named it as Dental Buddy. Here many free educational resources are there for the school children, so that they can be taught about the oral health. And Brush Time is another program in which they teach the nursery and school staff about how to brush teeth, so that the school staff can in turn teach the children how to brush the teeth correctly in the classroom. So these are two of the school programs that are running regarding oral health: Dental Buddy and Brush Time. Another interesting program under this foundation is Move It for Smiles. So as the name suggests, it's all about being active. So they are raising awareness by encouraging people to take part in walks, swimming, cycles, and run. And all this is sponsored. So they have named it as Move It for Smiles. So this is a sponsored program to improve oral health. So this is another point which we can take and implement it in India as well. Another one is HPV jabs for the boys. So here what they are doing is, as we all know, everyone believes that human papilloma virus, usually it affects the girls. Mainly it is responsible for cervical cancer. So it has been found now that HPV is now responsible for 5% of all the world cancers. It is one of the leading causes of oral cancer. So since HPV can cause oral cancer also, so now what they are doing is they are covering boys also under HPV jabs. So not only girls, they are giving HPV jabs to boys also to prevent oral cancer. And this is going on in UK. So, and they're doing it through a school-based program. So the next organization is Humble Smile Foundation. So here it has been established in 2015, and they are mostly catering the children in South Africa. And they have recently started a project in 2019, and they have named it Gogo's Give Smiles. And this is a school oral health promotion project under which they are performing oral health screening. And also they have a daily oral health program, which includes a 2-minute toothbrushing song. And recently they have launched a book called Gogo Says for the children. And this is for the oral health promotion. And in this book, they are mostly talking about what are the different parts of a tooth, how to take care of your teeth, what are the brushing techniques you can adopt. So these are the features under this foundation. Next organization is Organization for Safety, Asepsis and Prevention. So this organization is running in Atlanta, USA. It was founded in 1985. And so this organization mainly focuses on safe and infection-free delivery of oral healthcare. So they are dedicated in making every dentist visit the safest dental visit. So this organization is mostly working on your infection control and PPE. So they are working mostly on that. So this is another interesting organization I came across. Another one is Give Back a Smile. So this is a foundation of the American Academy of Cosmetic Dentistry. So here they mostly cater those people who have suffered dental injuries from domestic and sexual violence, that too free of cost. So it was developed in 1999, and till now over 900 dental treatments have been completed. So this is another organization. So yeah, one more organization is Global Dental Brigades. So this, what is unique about this organization is that it is the largest student-led movement for global health. Right, so students are involved in this organization, and here both global and medical has been merged. So Global Dental Brigade, one organization is there, and it works alongside Global Medical Brigade to provide a holistic model of healthcare reforms. So yeah, so the students, they shadow the medical and dental professionals, and they help in checking the vitals, prescribing medicines, they help in instrument sterilization, uh, public health education, teeth cleaning. So when regarding dentistry, so when a patient comes to their organization, or when they conduct a camp in any school or something, so they have 3 dental stations. So the first one is cleaning of teeth. So that is done by the students. So when the patient comes, first they clean their teeth. That is done by the students. Then dental hygiene education is given by the students again. After that, they are referred to the dentist. So once the teeth is cleaned and dental hygiene is given, they are referred to the dentist. So this is another very interesting thing which we can adopt by involving school children or university students in uh, providing dental care to the public in NGOs. So briefly, I have discussed the national and international voluntary health agencies and how they are functioning, what all provisions they are giving. But of course, in India, there are problems which the voluntary agencies are facing. So what are the problems which they are facing? So the first one is lack of funds. So obviously we are not getting much funds from the government, especially the grants which we are getting. It's not that much. So the NGOs are not able to function that effectively. So another problem faced is lack of dedicated leadership. So we have seen so many NGOs that come up, and the leaders in the beginning, they are very enthusiastic about the program, but slowly with the time they lose interest, and then finally that NGO collapses. So here, when we are starting NGO, we have to keep these things in mind. So that first thing is we should get proper funds from the government. We should have a dedicated leader. Then another issue is inadequate trained personnel. So for example, we as dentists, we have seen that dentists, once we get the degree, we are more interested into getting into a professional course or a professional job rather than joining as a volunteer in NGOs. So that is the issue they are facing. So they are not having much trained personals for them. So again, this issue has to be addressed. So we need to include trained people, dentists, if not dentists, at least dental hygienists or dental assistants, or dental, those school nurses. We can include them in the voluntary health agencies so that they can effectively render the services. Another issue which the agencies are facing in India is misuse of funds. So the funds, it has been noticed that the funds which is given by the government, most of the times the people are using it for their personal use. So again, there is a misuse of funds which needs to be addressed. So maybe in this case, the government can assign another group, or a group which has a surveillance of what is happening of the funds in the NGO. So that also needs to be done so that there is a proper utilization of the funds provided by the government. Another issue is monopolization of leadership. So what is this monopolization of leadership? We have seen in many NGOs that the secretary, the vice secretary, the president, the treasurer, every post is the same person. That is, the leader is the same person. So basically, other volunteers, the young people, are not getting the chance to be a part of that NGO and help the public. And the same person cannot take up all the responsibilities, right? At one point he will be frustrated and he will not be able to deliver at his best. So we have to stop this monopolization of leadership, and everybody should get a part to be a part of that NGO. Then the next issue is lack of volunteerism. So we have seen in earlier days, people were volunteering to serve the public, but as of now, nobody is interested in being a volunteer. They want to be paid for it, good hefty amount. So that is another issue, lack of volunteerism. Next issue is centralization in urban areas. So we know this inverse care law, right, that in 60 to 70% of our population resides in the rural area, whereas all our dentists, they want to work in the urban area. So that is inverse care law. We are providing the care to a population that actually doesn't need that much, and the rural population that needs the care, we are not providing there. So there is a centralization of this NGO in urban areas. So we have to stop that. We have to like make the NGOs focus more on the rural area rather than the urban areas. So next issue is modernization. So as I discussed in the beginning, there have been many modern techniques that have been developed, like as simple as internet, laptop. At least these basic things the NGO should have. But if the NGO is not being funded properly, how will they get these basic modern equipments with them to function effectively? So this is another issue which the voluntary agencies are facing. The last issue which I would like to discuss is target oriented and time bound government programs. So as I told you, the government provides grants for certain research projects, but there what the issue is that it is time bound. So here what they are doing is the government is focusing mostly on the quantity of the projects rather than the quality. So the NGO is not able to provide quality work to the public. So as it suggests, we should not have time bound projects and at least encourage the NGOs to have more of quality work rather than quantity work. So keeping a brief problems faced by these agencies in mind, I'll just discuss a few strategies which we can develop to improve oral health in India. Yeah, so there should be more collaborations with other NGOs and government agencies. I gave you a few examples in the beginning. In India itself, how they have beautifully collaborated with the state government and the National Health Mission. So we should have more of that. Then there should be partnership with dental colleges. So again, as we discussed, there is a problem of funding with the NGOs. So if they have a partnership with dental colleges, easily they can conduct camps, they can provide treatments with the help of the dentists or the dental students. Easily they get the mobile dental van from the dental college, right? And they can also adopt a village school or old age home with the help of dental colleges. And the immediate treatments like extraction can be done on site, and the elaborative procedures like RCTs or dentures can be referred to the dental college. And also the next point would be utilize the service of the school teachers, healthcare workers such as village health guides, daimas, and ASHA workers and Anganwadis workers. So this collaboration between medical and dental service providers can help reduce infrastructure and transportation charges. So this is a way where we can collaborate both medical and dental workers. So we can use this mobile dental services. We can utilize it to implement teledentistry services. So this is another way of improving the oral health services in India. So procedures such as screening, preventive services, and scaling. So all these procedures can be done by dental auxiliaries like your dental nurse, school dental nurse, dental therapist, dental hygienist, thus reducing the requirement of additional dentist. So this is very good way of reducing the cost of the treatment, cost minimization, you can call it. Then the main target, the main population that should be targeted by the NGOs are the children, physically disabled, mentally ill, impoverished elderly, then working poor people, homeless people, unemployed, and mainly the rural population. So in which way we can encourage the NGOs to serve the rural population? So one of the way is by the government. The government can encourage the NGOs by giving them additional benefits, like giving them awards, rewards, additional grants. So this is a way of encouraging the NGOs to go for the rural population. And also the volunteers who are working in NGOs, they also should be encouraged, and they should be trained, and they should be told the importance of working in rural healthcare, and they also should be awarded with that service. Another strategy would be training the school teachers on oral health through seminars and workshops. So this we can do on Teachers' Day, right? On Teachers' Day, this could be a very good way of celebrating it. The NGOs can go to the schools and they can train the teachers on oral health, so that later on the teachers can pass on that message to the children. And another strategy would be use of IEC materials to educate the public on oral health. Then, as I told you, the example in the beginning, Smile Express, it uses portable dental units. So we should also encourage the NGOs to go for portable dental units, because it comes very handy and you can easily take it to the doorsteps of the people in rural area. So again, here we can also celebrate this self check of oral cancer day. I found this very unique, which is done by Oral Health Foundation. We can also start celebrating this day, where we ask the population to go for a self check of their mouth for just 45 seconds. And again, we can have sponsored programs to raise funds for oral healthcare programs. And how they have a blue ribbon appeal, like that, we can also go for something like oral cancer badges. I think a similar sort of thing is done by the Tuberculosis Association of India. They have TB seal batches, and that they are selling for 5 rupees. So we can also have some batches like this on oral cancer awareness, and with that money collected, we can actually go for the oral cancer treatment. So another strategy would be involvement of young graduated students from university, colleges, and schools in dental programs. And yeah, we can also, the NGOs can focus on comprehensive care, that is like conducting nutritional support programs along with oral healthcare camps. And how we can improve the volunteerism in NGOs, we can use local media to advertise the importance of volunteerism. The NGOs can post their success stories in the media or maybe newspaper, so that more and more volunteers, they are motivated and they take part in this NGO program. Yeah, so these are my references. Thank you.
Okay, so yeah, do you have any more slides after this, Shubha? No.
No, sir. No,
Okay.
sir.
Great. Okay then. So the session so far, I think, very beautifully showcased by Dr. Shubha as to what exactly volunteer agencies or voluntary organizations could do in the field of dental public health. I think that was very, very comprehensive. So let's just open up the house for some discussion here. I think I'd like to invite Dr. Manjunath Puranik sir to please share his thoughts on the session. We will be going to the queries as well for most of the postgraduates here. I think, yes, sir. Good evening again. Yeah, kindly unmute yourself and speak. Yeah.
The coverage about volunteer organization, I feel, is very comprehensive. This includes the latest information. So it's highly appreciated, very useful. Newer concepts such as this blue ribbon, all those things are very interesting. Few things I think can also be started in our country. Very nice. Congratulations.
Thank you, sir.
Thank you.
Manjunath sir, would you take a minute and just share with us, since you've seen the evolution of various organizations, in terms of possibilities, how different is it for a government setup to extend support as compared to a private organization? Just some thoughts on that, just like some value-added points.
Now, can you elaborate on that?
Sir, what I was looking for is if the government wants to reach out to a private organization to initiate a voluntary organization like this, or if it's the private towards the government, what are the major challenges what you have seen, sir, through your years of public health industry in coordinating so many programs? The main hindrances and how to overcome them?
No, it is always the other way around, where the public, the private has to come forward to work with the government. And in fact, I feel the government organizations or the top, they are ready to participate with the private.
Okay, sir.
In fact, they are looking for partnerships. So it is up to the private organizations to meet appropriate authorities and showcase and join appropriately. It is possible.
Okay.
It's possible. It's ideal that we get into PPO model
PPO model.
rather than working in isolation, because most of the time there will be duplication of the work. So wherever the government is already working, the private can join hands, as it was put in the first slide, the functions of voluntary organizations. So if it's like clap. So if there are two hands, only then we can clap. The government and private should always come together, and that's how they can reach. Because the private organizations are always in touch with the people. So reach will be better if a private joins the government. This is my feeling.
Yeah.
Thank
you.
you.
Sir. Thank you for your thoughts. Sir. As always, thank you, Puranik sir, for sharing your knowledge and insights with us. Okay. So moving on to the other audience in this session. Any of the postgraduates would like to ask any questions, any doubts, please go ahead. You can talk to the speaker directly. Yeah, you can unmute yourselves and ask your questions. You may also put in the questions if you have anything in the chat box. From an exam point of view, I think just to add a little bit of note into that, the voluntary agencies which are working for dental public health has to function on any guidelines or anything. This is just a question from me, Shubha. Do we have anything which is like statutory guidelines which are mandated, or what are the legislative concerns in this area?
Yeah, related to the laws, there are few there, but as such for oral health, they have not formulated any guidelines, so that need to come up. For voluntary agencies, for normal healthcare service, maybe we can find a few guidelines, but for oral health, it has not been developed yet.
Okay, it's yet to
So
be.
maybe keeping so maybe keeping the problems which we are facing in mind, maybe keeping that in mind, we can develop certain guidelines related to that.
Okay, so as of now, there's no existing framework for that, right?
Yes, sir.
Okay, yeah. Okay, so do we have any other questions? Can go ahead and ask the presenter for today. Any of the PGs? Yes, Priya, Deepak, any of y'all? Finally, PGs.
Ma'am, thank you, ma'am. It was actually a very good presentation, and it was like I learned many new things also. So thank you for the information, and it was very comprehensive and interesting also, ma'am. Thank you so much.
Thank you so much.
Thank you, Priya. Yeah, Dr. Deepak, would like to ask anything? Any question related?
It was an excellent session, sir. It's always an excellent session, sir.
No. I mean, it's just about, this is actually the reason I told you this, right? Was we had to create a lot of awareness about the existing agencies. And when I had a talk with Shubha and we were working on this, I think kudos to her for actually putting together so much of information, which really benefited a lot. And I think this will be a major eye-opener for many of them, because these are relatable examples which can be duplicated across the world, right? Whether it's global or Indian examples, everything from the smile train to the spot, and even the religious organizations. So there are always people willing to work for the welfare of the society. Probably we can go up with a proposal and address these social welfare organizations and come up with the problem, like a model based on a PPO model, where there's a public and a private partnership, or it could be even the private players involved. So as they say, right, alone we can do very little, but together I think we can move a mountain. That really sums up what Shubha was saying. Yes, Shubha, so would you like to just give us like a take-home message and summary points for the PGs, especially from this topic? We just put this together in maybe less than a minute or so. Yeah.
Yes, sir. So as I gave you all the so many examples are there, and they are telling that we have done this, we have done that, but then still there are so many hindrances with this voluntary health agencies for oral care, right? There is no proper funding till now. Volunteers, they are not getting the volunteers, and also trained personals are not willing to work with the voluntary health agency. So we need to focus on these areas, and we need to motivate the people to take part in the NGOs and help them in coming up with new NGOs. And we, of course, we should motivate this PPO model also, so that we can finally cater the rural population at least with the voluntary health agencies.
Okay, so that was really wonderful, Dr. Subhashree, because I think that's really helpful for all of our students and faculty alike. Of course, we will be sharing this presentation in our student groups, so we would like you to go through that. And the recording of this session, as we speak, is going live on YouTube, so you can always go back and revise and look up the points and make a note of the examination questions as well. And finally, from PhD 101, we'd really like to thank and appreciate Dr. Subhashree for taking up this session and for sparing her time and her expertise in giving this lecture for our students, which is here to benefit a lot of them. Thank you so much, Dr. Shubha, and thank you, audience, for staying and connected with us. We are going to have subsequent sessions on various other such unique and interesting topics. And let's make this learning process of public health dentistry more fun and more engaging, because that's what is the real essence and beauty of it. So thank you so much, Shubha. Thank you all the
Thank you.
teachers and postgraduates and UGs who have joined with us. Thank you all so much. See you very soon. Stay safe and take care, everybody. Bye-bye.
Thank you, sir. Bye-bye.